my name is Morgan Duval. I'm a physical therapist, and today I'm going to be taking you through a progression of exercises to get to your single leg heel raise. Now, if you've had an injury, possibly to your calf, to your Achilles, or maybe you've just been through an ankle surgery and your physical therapist has cleared you to start working on this particular strengthening exercise, there is a progression that you can go to get to normal strength for a single leg heel raise. Now, normal strength for a single leg heel raise, like this, I expect that you will be able to do at least 25 single leg heel raises by the time that you return to sport after injuring your calf, possibly after a foot and ankle surgery, right? So 25 of those just like that. You can't hang on for balance, but make sure that when you are testing your strength, you're not like hanging on for dear life, right? You might find that that sounds totally impossible, especially after a big injury or surgery, but there is a progression to help you get there. Okay, so first part of the progression, it's a seated heel raise, okay? All you have to do, sit down on a chair, place your feet on the ground, flat on the floor like mine. Then very slowly, you'll rise up onto your tippy toes and slowly bring your heels back down. All right, just up and down. You should not push into pain. If going all the way up into your full range of motion is causing pain, then just take it a little bit lower, okay? Nice and easy up and down. Now, once this starts to get easier for you, you can progress to a standing position. All right, so what you'll do is stand up. I'm gonna use my chair for balance here. I do recommend doing this with a chair or maybe a countertop in front of you, just to make sure that you don't fall over and you have good balance, okay? So same idea, hands on the chair, engage your core, gazes forwards, rise up, come down. Now again, if this is causing you pain at your full range of motion, just don't go as high, right? Shift your weight forwards onto your toes, up onto the heels about 1 centimeter, then come back down. Slowly, as you gain strength and mobility, you should be able to go higher and higher up onto your tippy toes, okay? Also, when you first start doing this exercise, you may find that your non-affected leg is taking a bit more of your weight. So if my full body weight is 100%, I may find that if my left leg is injured, my right leg is taking more like 75% of the weight, and my left leg is taking about 25% of the weight. That's totally fine. Slowly progress towards 50-50, 50% of the weight on each leg. Once you're pretty comfortable and confident with 50% of the weight on each leg, and you can complete 20 to 25 heel raises just like this, no problem, we'll start progressing towards the single leg heel raise. To progress towards single leg heel raise, what you'll do, I'm just gonna turn so you can see a little bit better. You'll rise up onto both heels. You'll then shift a little bit more of your weight onto your affected ankle and then slowly lower down. So you're gonna start doing this with maybe just 10% extra weight on the affected ankle. So if mine is my left, I'm rising up 50% of the weight on each leg, shifting 60% of my weight over to my left, and then lowering down. All right, and slowly as you get stronger over time, you can shift more and more weight onto that affected ankle until you're at 100%. Okay, now what I recommend, when you shift 100% of your weight onto that tippy toe, hang out here for a second, right? If you're just shifting over and immediately dropping down, you're not getting the benefit of the exercise. So rise up onto the tippy toes, shift over, hold, and then slowly lower down. All right, rise up, shift over, hold, and then slowly lower down. Okay, so that already seems pretty hard, right? There actually is a way to make that even harder. You can do this exercise off of a step. I'm just gonna grab a yoga block to show you. I do not recommend that you do this with a yoga block at home because the yoga block can absolutely flip over, right? So this is purely for demonstration purposes. I recommend that you do this exercise off of a staircase that you have like bilateral handles that you can hang on to. All right, but for demonstration purposes only, you'll drop your heels down off of the block, or rather off of the step, rise up onto the tippy toes, shift all of your weight over to that affected side, then slowly lower down. You can see here how this block is kind of sketchy. This is why I don't want you to do it off of a yoga block. Make sure that you do it off of a solid step. But you can see, because you're doing this exercise off of a solid step, you're actually getting more range of motion, which is asking more of your ankle and of your calf and Achilles tendon. Once that is all feeling pretty good, you are now ready to try your single leg heel raise, all right? So just like we did with lowering down, you can start just by shifting a little bit more weight over onto your affected leg. So if I have 50%, in my double leg heel raise, I'm gonna try to do 60%, 40%. A little bit more weight and down. A little bit more and down. Slowly shifting more and more of my body weight percentage onto my affected leg until I can start going up and down with 100% of the weight on my affected leg. Again, if it hurts to go all the way up high, start down low like I'm doing right now, and then slowly progress to higher and higher until you have your full range of motion and you can complete 25 single leg heel raises. Once you have that, you're ready to return to single leg hopping, and you're ready to start talking with your physical therapist about returning to playing your sports.